Hello everyone, welcome to sqadia.com. I'm Dr. Hamna Iftikhar, and today's lecture regarding gastroenterology is about esophageal tumors. Esophageal cancer is the eighth most common cancer in the world, and it is the sixth most leading cause of cancer throughout the world. It has at least a 5% rate of deaths annually regarding cancers. The esophageal cancer is usually presented at the advanced stage where the curative treatment is very limited and the prognosis is very poor. And it consists of around 5% to 20% rate of 5-year survival in a cancer patient. So in today's lectures, we'd be studying about esophageal tumors and we'd be dividing it into 3 different sections. The first section is regarding carcinomas, that is the very aggressive malignant cancer regarding esophagus. The first topic we'd be studying about the different genetic factors that are involved in creating a cancer within the esophagus. And then the second topic, we'd be studying about the clinical features that are involved in esophageal cancer. And then what are the different types of ways to diagnose an esophageal cancer. And then the different types of treatment modalities that are present and we can offer those to the cancerous patients. In the second section, we'd be studying about specifically the epithelial tumors. Epithelial tumors are those tumors that are arising from the epithelial surface, from the mucosal surface of the esophagus. We'd be studying about the malignant type of epithelial tumors and the benign type of epithelial tumors. The malignant type of epithelial tumors are such as squamous cell carcinoma variants and the malignant melanoma, which are very rare. And the benign type of epithelial tumors, we'd be studying about squamous papilloma and inflammatory fibroid polyp. And finally, in the third section, we'd be studying about the non-epithelial tumors, tumors that arises from other than the mucosal surface and other than the epithelium. For example, vascular tumors and tumors from the lymph nodes. And thus, we'd also be dividing it into malignant non-epithelial tumors and the benign non-epithelial tumors, the malignant being the lymphoma and the sarcoma, and the benign non-epithelial tumors would be hemangioma, lipoma, hematoma. So these are the topics that we'll be studying today. Keep watching sqadia.com to study more about esophageal cancers.